Hello, my dear students and my dear future nursing officers. Welcome back to your channel Nursing Concepts by Raghav. तो आज के इस वीडियो में हम बात करेंगे स्किन ग्राफ्टिंग के बारे में, क्योंकि बहुत सारे स्टूडेंट्स में ये कन्फ्यूजन है कि रियली अभी सोर्सेज के बारे में बहुत सारा कन्फ्यूजन है। ओके, इसमें जो टाइप्स आते हैं उसके बारे में कन्फ्यूजन है, तो इसलिए मैंने सोचा है कि ये टॉपिक के ऊपर एक वीडियो बनाएं। तो वीडियो को एंड तक ज़रूर देखना ताकि सारे कॉन्सेप्ट क्लियर हो जाए। And if you are watching for the first time, please do subscribe and watch the video till the end, so that you never miss any point or the information related to the skin grafting. Okay, तो चलिए शुरू करते हैं आज के वीडियो स्किन ग्राफ्टिंग। Skin grafting. So graft actually mean a piece. Okay, here what we do is skin grafting means we will take a unhealthy skin or a portion of the skin from one area of the body, and it will be moved to the another area of the body, or especially the it is being used to cover the wound. Okay, so the wound may be or the damaged area of the skin, in order to cover it or patch it, we use a piece of skin that we call as a skin grafting. This skin graft, we call that whole surgical procedure, we call it as a skin grafting. So in other words, you can call it as a skin transplant. Okay, you can call it as a skin transplant. Okay, so means here the skin is being transplanted from one area of the body to the other area of the body. So major purpose of this skin grafting is to cover the wound. Okay, so especially the wound, like a small major wounds like in the burns or in the trauma, or even with the non-healing ulcers. So in such wounds we take a skin from an area, then that will be transported to the other area or to close that wound. So the skin may be taken from the patient itself, or maybe it may be taken from the other person, or even it can be taken from the animal source as well. Okay, so the we can call it as a skin transplant as well. तो चलिए देखते हैं इसमें टाइप्स क्या क्या होते हैं. So actually we have a classification based on two types. So one is the source, from where we extract the skin or from where we take the skin. So that is one classification, that is by species, we can call it as. And another classification is based on the thickness. Okay, so means how much uh, thickness of the skin we will extract from the either from the patient or from the other species. So that is based on the species. So we'll discuss both the things in short. So first we'll see the based on the species. This is whatever the classification I have written here. It is by species, classification by species. Okay, so in that first one is a autograft. See here, auto stands for auto means it is self. See here, the skin is taken from the same individual in the sense that is a patient itself. So means those healthy skin will be taken from the patient body itself, means from the other healthy area of the body we will take the skin and will be transported, or it will be moved to the to cover the wound of the patient. So that is auto means the skin is taken from the patient itself, or the same individual instance the patient. And the second one is a homograft. The homo stands for the same. Homo stands for same species means we are the humans, means the we will take the skin from the human only. Okay, it is, we can call it as human to human. So the skin is taken and will be transported to the human only. So that is what homo grafting. So in this actually we have two types. One is a syngenic, it is also called as a isograft. So iso means the same, homo or the iso means same. Isograft means here we will take the skin from the identical twins. Okay, identical twins means if they are twins like sisters, okay, girl and girl, baby, sorry. So this is called as identical, or boy and the boy, both are brothers, both are sisters. Okay, such kind of twins, we can take the skin, healthy skin from those identical twins. So this is identical. So many students will get what a confusion related to this isograft. Okay, so here identical twin stands for the same, means either the brother, means if the patient is a male, then brother, female means the sister, that is the twin. Okay, twin sister or the twin brother. So that is what the syngenic. Then the third one, the same homograft, it is allograft. Okay, so allograft, here it is taken from the non-identical twins. So in this, they can be, it can be taken from the girl, that is sister, or from the brother. So that is what we call as a non-identical twins. And even we can take the skin from the cadaver, means the deceased body, or the death or the died body, or from the person, we can extract the skin as well. So then the third one is a heterograft. Hetero stands for the different. The hetero stands for different. Hetero means it is different. So means from the other species, not from the human. We are extracting the skin, or we are taking the skin from the other species, like especially the animals. Okay, so animals, we do commonly use the skin of a pig. So here you can call it as a, you can consider it as a animal to humans. Animal to humans means the skin from the animals will be transported to the humans. So that is what we call it as a heterograft, and it is also called as xenograft. Okay, xenograft. And the last type is the cultured or the synthetic skin. So this is an artificially made or the lab cultured skin that can also be used for the skin grafting. So then here you can see with the picture. So auto grafting means the self. Iso means between the identical twins, means both are same, either the boys or the girl twins. So then that is called as a iso or the syngenic grafting, identical twins. And if it is between the same species but with the non-identical twins, okay, so there it is called as allograft. Even it can be non-identical twins or the cadaver. Then if it is from the other species or like animals, then it is called as xenografting. Okay, so this is all about the sources based on the species from where we take the skin graft. See, out of all this, the autograft has a, it doesn't have a no rejection. Okay, so the better result we get is the from the autografting, and isograft also gives a best result. Okay, so rejection chance is less, rejection chances are less. But when it comes to the allograft, okay, and the xenograft, so there is a most possibility of the rejection. Okay, so the success rate is always with the auto, then iso grafting, then allograft, and the xenograft. So this allograft and the xenografts are majorly used for the temporary purpose, not for the permanent purpose. So they are being temporarily, they are being used to cover the wound. So this autografting will have a better success rate, or the rejection chances are very negligible with the auto grafting. So it is better to consider the auto skin grafting for the better result. So this is one classification. See, the another classification we have is the based on the uh, thickness. Okay, so the skin what we extract, how much thickness we will extract, that is based on that we have a classification. That is, first one is a split thickness. Split thickness, thickness skin grafting. Okay, so this is STSG. So in this we will take the epidermis and little part of the dermis for covering the wound. So this is what we call as a split thickness skin grafting. And another one is the full thickness. Full thickness skin grafting. Skin grafting. This is FTSG. Okay. See, in the split thickness, we consider only the epidermis and the some part of the dermis will be taken. But in the full thickness, we take epidermis plus whole portion of the dermis is taken. So this gives a better result. Okay, better result, or the success rate is, or the with the full thickness we have a better result, or the success rate is high with the full thickness. Okay, so STSG, where we take the epidermis and the some portion of the dermis, where we can see the hyperpigmentation can be seen. But when we take the full thickness, so it looks, or it will match up with the color of the that is the surrounding skin. Okay, so because along with the in the dermis we are taking with the blood vessels and all, so it will get adjusted with the, or there is a proper blood supply, or the vascularization is proper with this full thickness skin grafting. Okay, so but it will grow, but here it won't grow, it will just closes the wound. So this is based on the thickness, split thickness and the full thickness grafting. So coming to the sites from where we take, or what are the sites for considering the harvesting the skin graft. Okay, so these are the site to harvest the skin, harvest the skin graft. So majorly we consider from the anterolateral aspect of the thigh, then buttocks, arms, and even the abdomen, abdomen also, abdomen, then especially scalp in the case of children's. Okay, so in case of children's we take the skin from the scalp, and supraclavicular and post auricular in the groin region. See, these three are majorly considered for the full thickness for grafting, or to take the skin for full thickness skin grafting. We consider the skin harvesting from the supraclavicular region and the post auricular region and the groin region, and these three are majorly considered for the split thickness, split thickness for covering the wound or for grafting. So this is the major sites from where we take the, or from where we harvest the skin graft. So now let's see what are the responsibilities of nurse, or responsibilities of nurse, or the post op care. So means after the skin grafting, so what care we have to, or what are the precautions we have to take. So that is very important in the skin grafting. Because there are so many complications that will occur after the skin grafting, majorly the rejection. Okay, so there is a chance of rejection or rejecting the skin graft by the host, or by the patient, or by the immunity. So that you should avoid it by taking proper care. Then the second complication that may seen is the infection. So there is majority of the chance of getting infection is seen with the skin grafting, and even there is a formation of hematoma, and even the edema can be seen in the after the skin grafting. See, these are the major complications that we see with the skin grafting patients. So to avoid these complications, we have to take care properly, or we have to provide a proper post-operative care. The first thing is we have to elevate the site, okay, to reduce the edema after the surgery or after the procedure. Then immobilization. The immobilization is very important. If you make a movement of the site, so there is chance of a dislodgement of the skin graft, or there is a chance of rejection, or there is chance of infection will be there. So immobilization is a very important part of the care in the skin grafting. The minimum of 5 to 7 days should be, the site should be immobilized in the case of split thickness. In the case of split thickness, but in the case of full thickness, minimum of 7 to 10 days immobilization should be done in the case of full thickness. This is very important. So on an average, overall we can consider 5 to 10 days. 5 to 10 days of immobilization should be done. Then proper dressing change will be done by the doctors and to prevent the infection. So these are all the major uh, care we should provide to the patient who are undergoing the skin grafting. Okay, so hope the concept is clear. So you just remember these all types of auto means self, that is from the patient. Homo means from the same, that is from the human to the human. So in this human to the human, if you consider from the identical twins, then it is called as isograft or the syngenic graft. And if it is considered from the non-identical or from the dead body or from the cadaver, then it is allograft. Hetero means that is from the different species, that is usually from the animals, that is from the animals to the human, there it is called as xenograft. So most commonly used animal is the a pig. Then even we have another that is cultured or the synthetic, means where the we can grow the skin by using the skin cells. We can grow the epidermis in the lab, and that can also be used. And even the commercially synthetic skin layers were available, so that can also be, that is bioengineered skin layers, epidermal layers can also be used. Okay, so this is all about the skin grafting. So hope the today's concept was clear, and there is no more confusion related to the sources of skin grafting. Okay, so I will see you in the next video, and please do subscribe and share it with your friends. Don't forget to press the bell icon so that you will never miss my next video notification. Okay, so till then, take care and keep studying. Thank you.